Okay. Well, thank you everybody for making some time in the middle of a work day to be here. This presentation is called Crisis in LA's Unhoused Community, How to Respond When You Are Needed. Just a couple notes from the top. This is a beginner's resource for what is a pretty complex problem that we face societally. So the information that I'm presenting you is a good start, but it's not a complete resource. And it might not prepare you for every scenario that you might run into out there. This information was compiled through a handful of interviews with mental health professionals who have experience with this population, and also just through internet searches of readily accessible resources. And I know, at least in the case of Sergio, for those of you not living in LA County proper, some of this information isn't going to be appropriate for you all. And so I would invite you to do some research on your own with regards to the resources that you can leverage specifically. Those are going to vary from county to county and municipality to municipality. But there's also a lot of information in this presentation that is going to be useful regardless of where you live. And also just a note on saviorism. I wanted to kind of address this concept right from the top. So this presentation isn't meant to stimulate saviorism. It's meant to equip people with knowledge that, when grounded in a prioritization of unhoused neighbors' autonomy and dignity, can be useful. So we're centering the autonomy and dignity of our unhoused neighbors when we offer help. And so the desire to help is natural, but helping without the needs of others in mind can be dangerous. All right, so with that said, let's begin. So some basic questions to start with. Where are we? In the US, 1 in 4 unhoused people and 45% of unsheltered unhoused people, which means those living in the streets, an encampment, or their car, live in California. So that's 1 out of 4 unhoused people in the US. In 2024, there were a total of 187,084 unhoused people in California. The point-in-time homelessness count indicates that 72,308 unhoused people live in LA County, with roughly 44,000 of them living in the city of LA. And so, just to put that into context, that means that 1 in 16 unsheltered, unhoused people live in the city of LA alone. 1 out of 16. And this last point, differences in the cost of housing, not in the rates of mental disorder, drug addiction, nor poverty, account for the housing crisis. And so this is just to destigmatize not having a home. Oftentimes it's a result of lack of affordable housing rather than some of the other more stigmatized reasons. And so I also wanted to just share a little bit of why I'm here. That's another question that's relevant. Some of my classmates in my MFT program here in LA might remember me sharing an experience that I had in the fall of last year, where I was on a lunch break in downtown LA, trying to get to know the neighborhood a little bit better. And on my way back to campus, I encountered a situation where there was an unhoused person in the middle of a busy intersection who was having a mental health crisis. And I kind of froze, and I left the situation feeling very helpless, which inspired me to research this topic so that if I found myself in that position again, I might be able to respond more decisively or helpfully. And so, in a way, I hope that this resource is there for you in that way too. And I did want to just give people an opportunity again, if you're able to share why you find yourself here on a Friday in the afternoon, um, listening to me speak about crisis intervention. And that's okay if we can't participate right now. I'll just on. So some learning objectives for this presentation. Participants will ideally understand best practices for maintaining personal safety and the safety of the person on whose behalf you are intervening. Ideally, you understand how power manifests during helping interactions. You'll ideally better be able to map the resources available for those who are unhoused. Again, in LA County, you'll have to do some research to kind of map resources for those in different counties or different parts of the country. And then also practice making decisions based on potential scenarios. Learning outcomes. Ideally, participants will understand the value in preparing backpack resources for outings in downtown LA or their communities in which they live. Participants will be given an opportunity to program the LA County Department of Mental Health Alternative Crisis Response ACR number to their phones for later use. And also learn about opportunities to further develop comfort intervening on behalf of those who appear to need help. And what I'll do is attempt to check in on the Zoom chat at the end of each slide. All right, I'm seeing folks may not be able to participate, so that's totally cool. And then Sergio, I'm seeing that this is kind of a proactive way for you to learn, so that you might be able to apply this if this kind of situation presents itself in the future. I think it's really great to proactively prepare for these things. Okay, so moving on. The first part of this equation, at least the way I conceptualized it, is understanding yourself. So this means personal safety when intervening. First thing is that you ought to know your limits. What is the most that you can do while remaining calm and attending to your own safety? And so, quite frankly, it's gonna take time and experience engaging in crises, but also in non-crisis situations, to begin to understand where your limits lie. Personal safety is about building spatial and interpersonal awareness. And so in terms of spatial awareness, best practices, you want to keep your hands visible. You don't want to raise your voice or engage in argumentative behavior. And you want to give your neighbor some space. In terms of like interpersonal awareness, I learned from professionals in the field that you want to rely on short sentences and easily understood vocabulary. You kind of want to be direct and to the point, and ultimately you're striving for understanding. So you want to make it as simple as you can. And I kind of alluded to this above, but you want to gain experience in non-crisis situations. And so I included two different organizations here. And I have personal experience working with both of these organizations on a volunteer basis. The first is Downtown LA Food Not Bombs, and that is their Instagram and other social media handle. And the other is J-Town Action and Solidarity, which operates out of Little Tokyo here in downtown LA. Okay, and then there's also the safety of the party in need, right? And so something that I found particularly interesting coming out of these interviews is that this reframing of agitation as an indication that the individual um, might be uncomfortable for a variety of reasons. Could be a lack of food, a lack of water, physical pains, or like medical conditions, or something else like that. And so I was thinking about different questions that you can ask when you're interacting with someone who's agitated. Um, they could be, do you need help with anything? Are you in pain? What do you need from me, if anything? Um, and so I'm by no means versed in like de-escalation, um, but further along in the slideshow, you'll be shown some resources where you might be able to, um, learn about de-escalating situations and things like that. But agitation, you can expect it in some cases. Something else that you can do to help folks feel safe is to carry nutritious snacks and or water with you. I've been told that it's sometimes a very effective intervention on its own. It's not going to, it's not going to solve all of their problems, but what it will do is it can help you build rapport with them. Um, Many of our unhoused neighbors have traumatic histories, including in relation to social services. Um, Ultimately, they don't know who you are, and a lot of them have traumatic pasts. And so, those who wish to help should change that if the individual desires that to change. And then remember bodily awareness. Your safety and the safety of the individual on whose behalf you're intervening, the unhoused community member, your safety is intertwined. And so if they feel safe, you're more likely to feel safe. This slide helps us kind of begin to grapple with the way that power manifests in helping relationships. And so, um, to begin with, I alluded to this earlier, you want to honor your unhoused neighbor's autonomy. And I know that, at least in the case of Lisa and I, and also Sergio, it sounds like, we're taught in client-centered therapy to uh, honor the autonomy of our clients. It's kind of similar in like helping relationship on the street, for example. Um, and so, when I mentioned that there's traumatic histories with a lot of unhoused community members, a lot of the time it involves their autonomy being disrespected. So that could be sexual trauma, trauma at the hands of police, trauma experienced while in the care of hospitals or shelters or psychiatric units. And so simply respecting from the get-go their autonomy can be a healing and rapport building gesture. In non-crisis situations, it's good to respect unhoused neighbors' desire to turn down help or additional resources. And so I made a note here that this is nuanced. Someone can reject your offer for help despite truly needing it. If you encounter someone who is very obviously in need of trained medical care, in the case of like an open wound, they're vomiting or shaking, or they're just so disoriented or incapacitated that they're left in a very vulnerable place, um, it behooves us to loop in resources and help regardless of their lack of desire to be engaged. I was thinking about this a little earlier today. It makes me a little uncomfortable, but ultimately, when I engage and when I imagine myself helping, it's a life affirming gesture. And I think if medically speaking, physically, life is in jeopardy, it's most important to intervene. A note about stigma surrounding public social services. There's a lot of trauma there. And a lot of public social services have not gained the trust or earned the trust of unhoused community members. And so therefore, it may take time to build a relationship with your unhoused neighbor. And in this case, repeated actions can help. And so, I think about like providing resources in the form of like snacks or drinks, just simple conversations as you're interacting with people. Repeated actions can really help. Again, this kind of ties into therapy. We're slowly building rapport. And I do acknowledge that the fact that when it comes to a lot of unhoused neighbors, it can be really hard to find them in the same place at the same time for repeated interactions, but it can happen. Oops, that was not intentional. Just finding my way back. Yeah, and so just like a note on relationship building, I found that like in my experience with J-Town Action and Solidarity or LA downtown LA Food Not Bombs, gradually the unhoused neighbors that I interacted with, especially those that I interacted with over and over again, our relationships did begin to open. There was information that was shared in previous conversations that could be relied upon in subsequent conversations that can really, be put towards building a relationship. Yeah. So this kind of gets into the nitty gritty of mapping the options available to people. And I'm now remembering, okay, no Zoom interactions right now. Yeah, so the nitty gritty of mapping the options available for you. So in the case where there are just general struggles with mental health or an inability to care for themselves, there is the option of direct distribution of food, water, and clothing. A note with regards to this, sometimes you'll be asked for resources that you can't provide, in which case it's most appropriate to say something to the effect of, there may be a trained professional who can help with that. The other option would be what's called the LA Homeless Outreach Portal, or LA HOP. I'm gonna try to open this link and effectively share this with you. This might get a little hairy here. Oh, we're doing it. Yeah, so the LA Homeless Outreach Portal is an effort on the part of I think it's the county of LA it's basically a tool for bystanders to use to report someone who may need help. And so discretion is required. Ideally, you're having conversations with the people that you're interacting with, and confirming securing their consent before you make an LA HOP request. But essentially, it kind of looks like this. There's a lot of information here about what the resource is like. Just know that this is a resource that should not be confused for like immediate medical or mental health emergencies, threats to self or other. It may be more appropriate to call 911 in these cases. But if it's the case of like an unhoused neighbor that you regularly see and you have some rapport with them, and they say, eventually they say, yeah, I could use a little help finding housing, or I could use a little help getting food stamps or something like that. This is something that you can use. Oh. Working our way back here. Bear with me. I got a little fancy. Okay, so we're back. Um, so that's those are some options in terms of like general struggles with mental health or an inability to care for themselves. If there's an active crisis that poses a threat to the self, there is the alternative crisis response resource. The picture on this slide is an advertisement that's put out in the city of LA. If you squint, you can see that there's a phone number there. And so the resource, I'll kind of do this again. We'll try to head over to the ACR webpage. It seems like the county, the Department of Mental Health has put a lot of resources into this program. Here's the phone number. I want to give you all a chance to program this into your phone right now. I know that you all don't necessarily know a ton about the resource, but at least have it in your phone so that if you do, continue your research and find that it can be useful, you can then use it. So that's 800-854-7771. There's a lot of information on this page about how it works. You're going to reach out. Someone is then going to respond. Keep in mind that response times can be quite long. And from there, whoever responds will be able to, help engage them with resources that can help them. So we're going to try to go back here to the slideshow. Perfect. So that's the alternative crisis response. That is a specifically non-police response. There's also direct intervention. You need to know your limits. So this harkens back to the example that I shared at the beginning about what I interacted with in downtown LA that time I was on lunch break. There's a world where I could imagine myself assessing the situation and going into the intersection to help guide them off the street. That is a very personal decision on your part. And again, you need to know your limits. The third option would be to call 911 and clearly articulate that it's a mental health emergency. There are a lot of implications for involving the police. They theoretically have teams that pair officers with mental health providers, but it's not a given that they're going to show up. It's more likely that a completely untrained and oftentimes incapable police officer is going to show up to these interactions, and there are very real risks associated with that. And then there's a third class of situation as far as I conceptualized, which is an active crisis that poses a threat to others. This really is a situation where you should call 911. It's another life affirming move, in my opinion. And so I'm just going to review some notes that I have here. Something to note, especially in the case of active crises that pose a threat to only the self or to self and others, especially if you're using a non-police resource to help. Response times can be extensive. In the case of the LA Homeless Outreach Portal, it's stated that the help is not going to arrive for at least a day or two. So there's a real lag with regards to the LA HOP resource. The ACR is also likely going to take a significant amount of time to show up. And so that's all to say that if you're truly invested in helping the individual and de-escalating the crisis and minimizing harm, you may need to be prepared to drop whatever you're doing, not only for the next hour, but for the rest of the day, in order to see the situation through and to be of help. And so, especially in the case of calling 911, it's really important to stay on site and ideally be a resource and potentially a voice of reason, so long as it's safe. And so in terms of like dropping what you're doing and taking that risk and making that sacrifice, because I truly think that that's what it is, it may help to just imagine a situation where you're in your community, you're on a lunch break, maybe it's a lunch break from school or work. Maybe you're needed back at school or your practicum site or something like that in 10 minutes, and you see an actively unfolding crisis. You try to imagine the competing thoughts and feelings that come up when you're faced with this kind of conundrum of having a responsibility to yourself and your schooling or your family or your job, but also feeling like you have a responsibility for your unhoused neighbors or anyone in that case who is interacting or who's having a crisis in public. Try to imagine the different ways that you're being pulled in that situation. So this is a little, I'm not sure how this is going to work if people aren't able to participate verbally, but this is a slide with hypothetical situations that you may encounter. And so this is practice with choosing the right path. In the first example, you see an unhoused neighbor in the middle of a busy intersection experiencing mental health crisis. This is truly a mental health crisis. There is a threat to self, not necessarily to others. You have a few options. You can try direct intervention only if your limits permit it. You could try the ACR, the Alternative Crisis Response Line, or you could try 911. In the situation of finding an unhoused neighbor that's passed out in the street in a puddle of vomit, you have an open wound on their leg that looks like it needs attention. This is a medical emergency. This person is very vulnerable. They're potentially sick, and their health is in question. This is a situation where a call to 911, specifically requesting a medical response, would be appropriate. And Sergio, I am seeing that your message in the Zoom. Yeah, 911. Your instinct would be right. In the third example, while walking to pick up lunch, you see an unhoused neighbor laying down on the sidewalk. They look disoriented and thirsty. You've seen this person before on this block. I'm gonna let that one sit for a few seconds in the event that anybody wants to respond via the Zoom chat. Yeah, I mean, approaching them and asking them if they need help would make sense. They look disoriented and thirsty. If you have water or a snack on you, it might be a good practice to ask them if they want it. if they can't verbally respond to you, I don't necessarily see too much harm in leaving it there for them. I've done that in the past. Um, yeah, this isn't necessarily a situation where I'd involve the police at all. It could be an LA hop situation where if you have rapport with them, you've seen them there before. If you have rapport with them, you can have a conversation with them about whether they want to be put into contact with the county so that they can get maybe access to food a little bit easier. That could be an LA hop request. And then in the last example, an unhoused neighbor is visibly agitated and is threatening passerby with a hard object. Yeah, this is a situation where it would be dangerous for you to directly intervene. It's a situation where LA Hop and the alternative crisis response line is not going to respond quickly enough given the potential danger of the situation. A 911 call makes the most sense. And then just this is a slide that can help us gain more experience and more confidence engaging in these kinds of situations. There is a resource offered from the LA County Department of Mental Health and UCLA called the Public Mental Health Partnership. Um, they offer live and recorded trainings. I'm going to do another hyperlink, so please bear with me. Their training series are organized uh, by theme. There is safety and crisis intervention. Also, if you keyword search, let's see. So in this training series, there are 5 different trainings. They might not all, they're not all going to be relevant to the unhoused population. But de-escalation, for example, de-escalation, prevention, intervention, that definitely applies. And these trainings are free. They're just there for us to use. And so you all can definitely, I'm gonna make sure that this presentation is shared with all of you so that you can then consult these links and explore these resources on your own. So that's the LA County Department of Mental Health / UCLA partnership. That was passed on to me by a professional who's a clinical social worker. And then it's really important to try to get some experience in non-crisis, lower stakes non-crisis outreach efforts, like the 2 organizations that I mentioned prior. You're also more than welcome if you have some experience yourselves with any different organizations to put those organizations in the Zoom chat now. But there are lots of different options. And so lastly, just kind of a recap of some takeaways. Prioritize your safety and the safety of your unhoused neighbor in that order, really. Just because your safety is slightly ahead of the unhoused neighbor's safety doesn't mean that the unhoused neighbor's safety doesn't matter. It's just a matter of you need to keep yourself safe. If not, you know, because of you, you can you need to be alive in order to use this information and help others in the future. You want to center your unhoused neighbors' autonomy and dignity. Oftentimes, crisis response with unhoused neighbors is a relationship building process. I say oftentimes because there are the situations where it's just an acute crisis and dialogue or connection isn't possible. And so relationship building doesn't really take place. But in a lot of cases, relationship building can take place and ought to take place. And it takes time. Um, I was told by the two professionals that I talked about or that I talked to and interviewed that you need to be okay with being told no. Some people don't want your help. A lot of that has to do with stigma and them not knowing you and the various things that you represent by offering them help. You have to be prepared to drop everything that you're doing. There's sacrifice involved in this. And then proactively prepare by packing some drinks and snacks when going out for a walk. This presentation and attending this presentation is proactive preparation, and it should continue from here, ideally. And there are ways, you know, one thing that I thought about as a student, being a part of a larger institution like the Chicago School is we can try to leverage campus resources for this purpose. So I thought about, you know, whether it's Sergio at the Anaheim campus or, you know, us at the LA campus, we can ask the institution to have some kind of stockpile of drinks, snacks, not necessarily for us, but, you know, for outings in downtown or wherever we are, so that we can offer something like that to people. I think the institution would be amenable to that. And so that is pretty much the end of it. We've got our references and then my thanks to the people who helped me develop this presentation. Dr. Isa Hashemi is here in attendance. Thank you so much, Dr. Hashemi. Dr. Jones here at the LA campus was also was integral. Tammy Hammock at Mentors Inc. and Elizabeth Coe. And I also talked to LA County Department of Mental Health phone operators, and they were also very helpful. So I guess I'll give you all an opportunity to ask me any questions verbally or via the Zoom chat now. You also are all in contact with me by email at this point. So if you have any questions that you want to forward to me that way, or if you have any concerns about anything that I presented, I'm very open to that. Yeah, any questions?
I don't have any question, but I want to thank you for your courage, for your perseverance, for the you know, sometimes we encounter a lot of these incidents in our lives, right? And we might not be able to, you know, ask the question, why am I here? Or what am I doing? Or what can I bring to the community? And I want to thank you for this step to bring consciousness to our community and inform us about all of these possibilities and options that we can have. And this is very informative, and this is very authentic in a sense of building relationship with the community. I want to thank you.
Yeah, Sergio, I think it's a great idea to look up what Orange County has to offer. All right, everyone. Well, thank you so much. I'm going to be sending this presentation to you all by email. Yeah, be well and take care.